name is Allison Johnson. My population is grandparents raising their grandchildren. So when parents become unable to take care of their children, one of the main safety nets we have in place in society is the creation of these grandfamilies. A grandfamily is grandparents who are raising their grandchildren. Two of the main ways they get custody, informal and formal. So a formal custody arrangement happens usually through the foster care system where the grandparents become foster parents. But usually, 95% of the time, it's an informal assumption of responsibility for their grandchildren. Because of this, grandparents save taxpayers over $4 billion a year by taking over informal care of their and guardianship over their grandchildren rather than having them placed in the foster care system. Locally, 7,800 grandchildren are raised by their grandparents in Davis County, and the only place I could find this number was in a newspaper article from 2013 from an organizer of a support system that helps these grandfamilies. So I'm going to assume that the number has grown exponentially in the last almost 10 years. In the state of Utah, we have 19,000 grandparents raising 24,000 grandchildren. Nationally, 2.6 million with 5 million grandchildren. And like I said earlier, only 5% of grandfamilies are officially in the foster care system. Some contributing factors and the social determinants of health that I felt affected these groups the most was economic stability and social and community context. With economic stability, often these grandparents are people who were planning on retiring soon or were already below the poverty line themselves, and now they've already raised their kids. And now they need to become responsible for raising their grandchildren, and that is expensive. So all of a sudden they can't retire anymore, and they can't travel, and it completely changes the lifestyle that they had planned on having. They can't be the fun grandparent anymore. Now they have to be the grandparent or the parent. Anyway, so this economic instability that comes from raising more children when you are in your 60s, 70s, and 80s. And then there's, of course, the social and community issues. There's a lot of social stigma for the children and for the grandparents, especially where drug abuse is concerned. In some of the articles I read, grandparents face this stigma of, well, you couldn't raise your own kid. What makes you think you can raise your grandchild? And then, stigma for the kids as well. Like, well, why do you live with your grandma? You show up to the PTA meeting and you're 40 years older than all the other parents. And then also there's the relying on the parent who is not stable. And they're not showing up when they say they're going to show up, and they're not in a healthy enough space to take care of their child. And often these children have been through trauma, and that's something that the grandparents have to find a way to help them through. So looking into the root causes and some, contributing factors, you have the macro system factors, which is, economic instability that makes it so parents can't raise their children. There's also the emphasis of placing children with family before putting them into the foster care system, and it's kind of seen as the family's responsibility to make up for the slack of the parent and to raise these children. There's a higher percentage of grandfamilies that are made up of single women over the age of 60 still working and who are less educated. There's also higher proportions of Black, Hispanic, Native American, Native Alaskan grandparents raising grandchildren, but the white population is steadily increasing, and this is attributed to the opioid epidemic. Some microsystem factors are abuse and neglect. The main one is drug addiction. There's mental illness, incarceration, and those are kind of like the big ones. These are kind of the main reasons grandparents assume responsibility for their grandchildren. But there's also disability, sudden disability of the parent. They can't physically raise their child anymore, or they get an extreme mental illness out of nowhere, or sudden death. Often when These are the case, like kind of the sudden ones. Grandparents didn't see it coming. These ones, usually the grandparents saw it coming, and there's more trauma involved, like long-term trauma. And I'll kind of get into that later. With Maslow's hierarchy of needs, the children and the parents are not safe. Sometimes even their physiological needs are not being met, and that's why they lose custody of their children, and that's why they end up going to the grandparents. The fact that the grandparents are stable enough to become primary caregivers tells us that they have their physiological and safety needs met, and the fact that they want to take care of their grandchildren and they want the parents to get better shows love and belonging. Difficulties happen with the esteem and actualization. The esteem, once again, you got these confidence issues, and the self-actualization is getting to a place where you can separate the parent from the addiction and find a way to want the child to have a healthy relationship with their parent, with the grandparent. There's so many dynamics at play. So with physical health, there was a slight increase in diseases like diabetes and hypertension, but they don't know if that was there. They can't find a strong enough correlation to say it's because they're raising their grandchildren. One thing they have seen, though, is that these grandparents will put off their own care to prioritize their grandchildren's care, and often it's because these grandchildren, especially in the cases of addiction and trauma, they have not been having their regular checkups, dental appointments, vaccines. They've been exposed to toxic chemicals in utero or in their homes. And so the grandparents just focus in on helping their grandchild get healthy and safe, that they neglect their own self-care. The biggest concern they have is with stress. And just physical, psychological well-being. The depression is higher in grandparents raising their grandchildren. The financial problems, the family dynamics are really hard. Who's the parent now? Is it the one who gave birth to them or the grandma who's raising them? They sometimes have to have legal custody battles. That's really, really stressful. The sudden change in lifestyle or the gradual change in lifestyle, they don't get to be the fun grandparent anymore. They are now the guardian of these children. It's often multiple crises that were leading up to something traumatic that caused the child to be with the grandparent, and that leads to chronic stress. They have to repair difficult, traumatized grandchildren usually, and there's just a lot of grief and resentment and difficulty creating healthy boundaries with the parent and helping the grandchild, and once again, the social stigma. One thing we need to focus on is the children's health. They have complex emotions for their parents. Most often these children love their parents, but they don't feel safe with them, and this can be really confusing to them. 75% of children living with their grandparents have been traumatized. This takes therapy and time and care to get through. If they are living with someone who's using drugs, they have an increased risk for poisoning. They also have exposure to drugs or alcohol, whether in their home or in utero, that will affect them. They have been abused and neglected. They have food and housing insecurity. They have a lot of behavioral difficulties. They have higher risk for ADHD, depression, behavioral issues, attachment disorders, PTSD, marginalization from their peers. But what I want to focus on the end is resilience. There are a lot of personal strengths. A lot of these grandparents have said that they were grateful that they got to raise their grandchildren. They're grateful that they got to raise them they were in a place that they could raise their grandchildren in a safe and loving environment. That sometimes, the parents heal enough that they can get custody back, or they can at least have a healthy enough relationship again. They have a positive outlook on the future. They become advocates for other grandfamilies, these grandparents. And like personal strengths like resourcefulness, positive thinking, compassion, these increase the likelihood of creating post-traumatic resilience growth for themselves and the parent and the grandchild. And just like the support systems that are in place to help these grandfamilies, they can be successful if if they're willing to get that help. And when just increased love and pride for their grandchildren, they become, a lot of them have said they don't resent the grandchildren for this at all, and they can actually repair the relationship with their child who lost custody, and are able to have a positive outlook for the grandchildren.